this was the result of a meeting, including a large number of experts in the field involved in research in cerebral venous thrombosis. This was coordinated by the International Cerebral Venous Thrombosis Consortium, which is a group of specialists dedicated to CVT that aims to increase collaboration across the world because this is a less common form of stroke, and we do need large collaborations in order to understand better the disease and the management and the treatments. So in this meeting, we were trying to understand for each area what are the unmet needs. So what do we need? What are the gaps in the knowledge for each of the areas? So we try to cover a bit of epidemiology, pathophysiology, imaging, both medical treatment with anticoagulation, interventional treatment like endovascular treatment, prognosis, also outcomes. And for each of these areas, there are things we need to understand. For example, for the epidemiology, we don't understand well what happens in some areas of the world, especially developing countries, especially Middle East, India, Brazil, Latin America. We do have several countries that have high rates of cerebral venous thrombosis and different epidemiology, but we still don't understand exactly. So this is one of the questions, for example, concerning epidemiology that we would like to address. Of course, concerning risk factors, it has cancer and what should be the protocol and the workup for these patients, when to do some tests and additional exams. This is also a question. Of course, the diagnosis, still we know that many patients have a delayed diagnosis. Headache is the most common presentation, which is a very common complaint in an emergency setting, but we do need additional exams to rule out CVT. So one of the questions is also if we can improve this and we understand better who are the patients that need this additional imaging, and in order not to miss diagnosis and delay treatment. Also, of course, concerning the pathophysiology, there are a lot of questions that remain to be answered. Many of these patients do not have risk factors or have risk factors that have just a small association with the disease. So we do need to understand better what happens. Also concerning the evolution of the brain lesions, the prediction of the brain lesions. We also discussed several questions. Also concerning treatment, of course, other types of medical treatment of intracranial hypertension, and this question around endovascular treatment has discussed before. It is a big knowledge gap that we still have, not to know who are the patients that benefit, who are the patients that will not have a good response to anticoagulation treatment. That is something we should definitely work on more in the future. And concerning outcomes, as we were discussing before, many of these patients are young adults. They are active, they have occupational activities and family life, very active, and they have complaints during follow-up that are not accounted by the ranking scale. And we do need better measurements for the quality of life and for the performance of these patients in order to be able to improve prognosis as well for this group. So there are lots of unanswered questions in this paper. We try to summarize, to define priorities, and we hope this can help also funding agencies to understand and the needs of research for this specific disease, and also to guide other researchers that want to be interested in this field.